Are you working at the front desk of a medical practice and confused about how much to collect from your patients when they have a high deductible plan? If so, today's video is for you. All right, friends, I'm so excited that you're here. My name is Jasmine Veles. If you are brand new here, you might consider liking this video, subscribing, and joining our channel for content related to the business of healthcare. I have more than 2 decades of experience, and so I know a little bit about this world. So if you are someone who's in a medical practice and you've been faced with the headache of high deductibles and do not really know what to do, how to navigate, how to collect, and you are flat out confused, we're going to chat about this today and hopefully clear things up a little bit for you. If you have follow-up questions or things you want to have us clarified, always feel free to pop a comment in the comment box below, because we're always here to answer questions for you, whether it's here in these videos or on the next live stream. All right, so when a patient has a high deductible, and high deductibles can be relative depending on the style of practice and perhaps the amount of the services that you are billing, because a patient could have a $2,000 deductible that might seem quite low for someone who has a service that's billing upwards of $800 to $1,000 per service. But if you're in a specialty that's being reimbursed something like $60 a service, then $2,000 is a pretty high deductible. So it's very important to take that into consideration when you are classifying what a high deductible is. And I say that because we do recommend that if a patient has a high deductible or a deductible that is going to be sizable and perhaps impact what you would be reimbursed by insurance, that you inform your patient before you care for them, because nobody wants to receive a surprise bill. Nobody. So make sure that you let your patients know that they have a deductible that needs to be met. You're going to be checking the remainder of their deductible, letting them know that the deductible is X amount and it will be resetting on X date, because it typically resets on an annual basis once a year, whether that's calendar year or plan year. And it's important to let your patients know that they are not required to pay the $2,000 directly to you, but they would be responsible for up to the allowed amount, which is the amount that the insurance plan allows, and taking into consideration your contract with the insurance company if you, provider, are contracted with the insurance carrier. Takes those two things into consideration, and our patients then are responsible for said allowed amount for the service that's being rendered. A lot of our practices, we recommend that you inform your patient in advance and maybe even give them an opportunity to pay something towards the deductible rather than having to receive a larger bill in the mail. And that can help a lot of different things. Obviously supports your cash flow. It also ensures that you are going to receive some sort of compensation, because reimbursement is low on statements, payments, meaning payments that are coming in after the services have been rendered. So it's important to keep that in mind when you have a situation that a patient has a large deductible, that you are absolutely okay to collect an estimated amount towards that deductible if you know with certainty that the patient is in fact going to be held liable for said service. Other thing to know is reminding you that this amount is from the allowed amount. So do not calculate the deductible estimations from your fee list. As a provider, as a practice, you have your own list of fees. The service payments that the patient is going to be making are not according to those fees. It's going to be according to the contract with said insurance company. So unless you are not contracted with that insurance company, you will want to refer to your contracted rate according to that insurance company. It's also known as a fee schedule. If you do not have access to that, you can reach out to the company. Sometimes they have that information available on their website as well. There are situations in which you would not want to collect. First off, if a patient is a Medicare patient and they're coming to you at the start of the year, our Medicare patients have very, very small deductibles. So it's really important to know that, because our Medicare patients sometimes are going to multiple providers in a period, oftentimes a couple of providers before the middle of the first month of the year, then you will want to make sure that you don't impact the patient by collecting from them too quickly, because if they've gone to see other providers, those providers may have already submitted their claim and they will be paying the deductible towards the care they received from those providers. Okay. Now, other thing to know is if a patient recently received surgery or a large service, a service that has a larger ticket or larger price, then you'll want to take that in consideration, because if a patient has a service that has just taken place just a couple of weeks or a few weeks earlier, and perhaps it's a surgery center that takes a little bit more time to get their claims in, but claim is still in process, then you might be collecting towards a deductible in which a patient has already met from a previous provider. All right. Deductibles are timed or are applied towards our patient's care based upon when the claim is received. So if your practice is slow at getting your claims out the door, even if you collect from your patient, you might be beat by another provider's office and you will need to refund your patient. So we'll talk more about that in another video. Okay, deductibles, I know how confusing they are. I hope today's video helped to clear things up just a little bit for you. If you have more questions, please pop a comment below and let me know where I can help you better understand the world of deductibles or anything in the business of healthcare. And once more, my name is Jasmine. Make sure that you stay connected to our community. There's all kinds of information on ways you can do that in the description box below. You might consider subscribing and joining our community here on YouTube. Thank you so much, and I look forward to seeing you in the next video. Take care.